Extract 1. Questions 1 to 12. You hear a pulmonologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please have a seat. I'm Dr. Shane Paul, the pulmonologist you were referred to see.
Thank you, Dr. Paul. It's nice to meet you.
No worries at all. Can you tell me why you're here today?
Well, it's this terrible cough I've had for the past 6 weeks. It just doesn't seem to go away.
Oh, that's quite a long time. Can you tell me a bit more about the cough itself? Is it productive, meaning does it bring up any phlegm?
Actually, it's mostly dry. Sometimes there's a little mucus in the mornings, but not much.
Okay. Is the cough worse at any particular time? Nighttime, perhaps, or after exercise?
Definitely it's worse at night, actually. It keeps me awake sometimes, especially if I'm lying flat. During the day, it seems to get triggered by things like dust or strong smells.
Mihiraa, have you had any other symptoms along with the cough? Fever, shortness of breath, chest tightness?
No, not really. I do get a bit out of breath if I climb stairs quickly, but otherwise, my breathing feels normal.
All right. Now, before this cough started, did you have any recent illnesses or colds?
Not that I can recall. The only thing is, I've been feeling quite stressed lately, with work deadlines and everything.
Mihiraa, stress can definitely exacerbate existing respiratory issues. Now, can you tell me a bit about your medical history? Do you have any existing health conditions?
Not really. I've always been pretty healthy, except for a mild asthma condition when I was a child. But I haven't needed any medication for that in years.
Okay, good to know. Are you currently taking any medications?
No, thankfully. I'm generally healthy. Though, I do take a less for birth control, only if that's relevant.
Noted. Have you tried anything to treat the cough yourself? Over-the-counter medications, home remedies?
Yes, I've been taking cough suppressants from the pharmacy, but they haven't really helped. I've also tried drinking lots of fluids and using a humidifier at night.
Those were good steps to take, Mihiraa.
Doctor, I even tried some herbal teas and honey remedies from my grandmother, but nothing seems to work.
I understand. Does anyone in your immediate family have any respiratory conditions?
Actually, my grandfather on my mother's side has COPD and interstitial lung disease for paternal grandfather. But other than that, no.
Okay, Mihiraa. Thanks for that information. Based on what you've described, it's likely we'll need to do a chest X-ray to get a clearer picture. Depending on the results, we might need to perform additional tests like a pulmonary function test.
Okay, that sounds all right.
In the meantime, Mihiraa, I can prescribe you a low-dose steroid inhaler, Pulmicort Flexhaler, to help reduce inflammation in your airways, and hopefully alleviate the nighttime cough.
Thank you, Dr. Paul. I appreciate you taking the time to listen.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hi Mihiraa, come in and have a seat. So, what brings you in today?
Hi Kaylee. It's been bothering me for a while now, but this dandruff is just getting out of control. It's quite embarrassing actually.
I understand, Mihiraa. Can you tell me a little more about it?
At first, it was just a bit of dryness, but now my scalp feels itchy all the time, and there are white flakes everywhere, even on my clothes.
I understand how frustrating that can be. When did you first notice the dandruff?
It started gradually a few months ago, but it's gotten much worse in the past couple of weeks.
Do you have any scalp redness or soreness, Mihiraa?
No, I haven't noticed any redness or soreness. Just the persistent itchiness and particles.
All right. Does anyone else in your family have a history of dandruff or other scalp conditions?
Actually, yes. My dad used to have a similar problem, but I don't know how he used to treat it. And my grandmother had folliculitis.
Okay, Mihiraa. Have you tried any shampoos or other treatments for the dandruff yourself?
Yes, I've been using a regular dandruff shampoo containing ketoconazole from the drugstore, but it doesn't seem to be making much difference.
I see. Sometimes over-the-counter options aren't strong enough. Dandruff can be caused by a variety of factors, including dry skin, fungal overgrowth, or even stress.
Stress? Well, things have been a bit hectic at work lately, so that could be a possibility.
It's definitely worth considering, Mihiraa. To manage the dandruff, I can recommend a medicated shampoo with selenium sulfide to combat dandruff. It should also help to control flaking and itching associated with dandruff.
That sounds good. Is there anything I can do to manage the stress too?
Absolutely, Mihiraa. Stress management techniques like relaxation exercises or meditation can be very helpful. These techniques not only help to calm the mind and body but also reduce the physiological effects of stress, such as elevated heart rate and blood pressure.
Undoubtedly, I'll give it a try. Are there any other aspects I should be mindful of, or take into consideration?
Yes. There are also some dietary changes you can try, like focusing on foods rich in omega-3 fatty acids, and reducing your intake of processed foods.
Interesting, I didn't know diet could play a role.
It can sometimes. Well, Mihiraa, I will schedule you for a follow-up appointment in 2 weeks to see how you're responding to the new shampoo, and to discuss your stress management further. In the meantime, if you experience any scalp irritation or worsening of the symptoms, please don't hesitate to call the clinic.
All right. That sounds like a plan.
Building on your progress, we'll tailor specific recommendations such as behavioral adaptations or seeking guidance from a healthcare professional during your next appointment.
Thanks so much, Kaylee. This is very helpful.
That is the end of Part A. Now check the answers.